We want to get to the latest now on what we do know about this COVID-19 crisis. The death toll has topped 10,000, but nearly 20,000 Americans have now recovered from the virus, and that's the good news right there. There are also indications that the curves are starting to flatten in hotspots like New York, California, Washington, New Jersey, some of the hardest hit states in the country. And in Wisconsin, there is going to be voting. The primary is back on after the state Supreme Court stepped in to reverse the governor's order suspending in-person voting due to the coronavirus. That was backed up by the U.S. Supreme Court, a divided U.S. Supreme Court. We're going to talk about that with the Surgeon General.
All right, the Surgeon General, we're going to talk to him in a few moments, George, in an interview that you did with him. But first, we begin our coverage with Tom Yamas, who's outside a hospital in Brooklyn this morning. Good morning, Tom.
Michael, good morning to you. As conditions possibly improve here in New York, the governor here, Andrew Cuomo, warning residents not to be reckless. This as hospitals like the one you see behind me here in Brooklyn are working around the clock to keep up with all the cases. A nurse here tells me they work 12 to 16-hour shifts, no break, no time to eat. They're too busy saving lives.
This morning, hospitals across New York trying to hold on. The rate of cases may be stabilizing, but the pressure still rising.
Every one of these patients who comes in needs oxygen. Some of them need ventilation. We had to put 14 patients on ventilators in a 12-hour period just yesterday.
Dr. John Marshall guiding ABC News through the ER of Brooklyn's Maimonides Hospital. We see doctors and nurses, PPE shielding everything but the intensity in their eyes, monitoring vital signs, fighting to keep patients alive.
We have healthcare workers.
Outside, we speak to the head of surgery about the days ahead, worries of a surge, talk of the apex, so many unknowns.
How long you guys think you can keep going? What do you think?
We're going to absolutely keep going till this damn thing is over. We're not going to stop. We're not going to give up. And it's hard, and people are getting tired. But we're not going to stop, and we're not going to slow down.
That will to beat the virus has helped. But even the governor worries, how long can it last?
This is a hospital system where we have our foot to the floor and the engine is at red line and you can't go any faster. And by the way, you can't stay at red line for any period of time because the system will blow.
With more than 130,000 cases in the state, Governor Andrew Cuomo announcing hospital admissions are now down and the daily fatality rate hitting what appears to be a plateau over the last few days.
The numbers look like they may be turning. Yay, it's over. No, it's not.
The governor adamant people continue to follow social distancing guidelines, increasing fines of violators to $1,000.
This is serious. What right do you have to act irresponsibly in a way that could get you sick or someone else sick?
Leona Hernandez, an ICU nurse from Minnesota, is getting ready to leave her husband and 3 young children for 2 months, joining the front lines in New York City.
We call her she's the superhero. And they're like, she's not a real superhero, Dad. And I'm like, yes, she is. She's a super nurse.
The volunteer effort comes as a new report from the Health and Human Services Office of Inspector General reveals more than 300 hospitals had major concerns 2 weeks ago about lab results taking too long and not enough staff to run those ventilators if they were to get them. Problems seen across the country and now in Detroit.
At Beaumont Hospital, we have less than 3 days until N95 masks run out. At Henry Ford Health System, we have less than 4 days. And at the Detroit Medical Center, less than 10 days. At all 3 health systems, there are less than 3 days until face shields run out, and less than 6 days until surgical gowns run out.
And in Louisiana, hospital admissions trending downward. The governor there saying they may be seeing a flattening of the curve, something doctors tell us they are also witnessing.
I don't expect somebody to snap their fingers and all of a sudden all these patients are gone. That flattening of the curve, it'll last a while, but we'll stay underneath the capacity line and be able to take care of patients that are coming in.
And one more hopeful sign this morning, California joining Washington and Oregon in donating ventilators, 500 of them, many of which will end up right here in New York. California's governor hopeful, at least for right now, they may be flattening the curve in the Golden State. George?
Okay, Tom, thanks. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.